Simply put, co-creation is designing and creating something together. And it's been around for nearly 60 years, being used in areas like product and service design. More recently, we're seeing just how valuable it can be when adapted and applied in global health, particularly when working at the community level.
Co-creation is gaining momentum in health interventions because it makes them more relevant, acceptable, and impactful. But beyond the buzzword, how do we define co-creation in global health today? Co-creation is both a process and a mindset. It is a process in which practitioners, researchers, and community members develop health solutions together, each bringing something vital to the table, not as subjects or experts, but as equal partners. And it is a mindset that insists on shared ownership, mutual respect, and the value of lived experience alongside scientific knowledge. The challenge for both new and experienced co-creators is that while co-creation is a process, there is no one-size-fits-all approach. It can take many different forms, and it often requires careful planning and a lot of resources. That is why, while co-creation is important, it's just as important to remain realistic. Ask yourself, do you really need to co-create a solution from scratch? Or are there existing solutions that you can co-adapt or that could fill parts of your co-creation process? If you're struggling with that decision, here is a simple decision tree to help you figure out when co-creation makes sense. If there is already a proven solution and process that works in your setting, just apply it. No co-creation needed. If a solution does not work well in the real world or needs to be tested or adjusted for your specific context, you can co-adapt that solution or co-create the implementation process. And if there is no solution, no process, and you know it cannot be solved on your own, then be prepared to fully co-create. This is a simple guide. Keep in mind that every co-creation project is different. How you plan will depend on the problem you want to address, the context, and the lived realities of the community you are working with, and the resources available to you.